everyone, so it's Dr. Reams
Hi.
here with Dr. Urego. So I'm going to have her introduce herself so that you guys can get to know her a little bit and what a phenomenal resource she is here in Chattanooga.
Thank you so much. Hi, I'm Heather Urego. I'm an OBGYN with UT Women's Health. Our main office is down at Erlanger in the Medical Mall at downtown. But we have resources all over the place, and I'm starting a new sexual health clinic right here in this office at Erlanger East.
Yeah. So what we're going to talk about a little bit today is some of those sexual side effects that may come along with some of those breast cancer treatments, such as chemo, radiation, post-surgery, anything like that, because yes, while you're getting treated up here, the whole body's affected. So what can you talk to your OBGYN about? What should you somewhat expect them to talk about? Everyone's obviously a little different, but there are options out there for just about everything and everyone. So one of the most common ones we hear about is incontinence, so leaking on themselves, and pain. Mm-hmm. So what if someone came to you and said, hey, I'm receiving breast cancer, chemo, and I have radiation, what would you kind of talk to them about or anything like that with pain?
Okay, so is it like, so first we're gonna, anytime we start any of things off, it's gonna be a really thorough history, and sometimes I worry that I'm jumping into vaginal stuff a little too fast, but we want to get a really thorough history. When are you having this pain? Is this when you're sitting? Is this all the time? Is this specifically during intercourse? So I would want to know specifically when they're having this pain.
So if they're having it with intercourse. So
pain with intercourse. So there are lots of things this can be due to. This can be due to tight musculature. Remember, the pelvis is actually, I wish I had my pelvis. It's all made out of bone. And so basically there's only like a bony ring and everything else is muscle. So really making sure that those muscles are not too tight, not too tense. Anything can kind of set off the tension in those muscles. So if I do an exam and I exacerbate the pain by pushing on those muscles, we can most certainly get you into a physical therapist that can help us out with that. Pain can also be due to things like vaginal dryness. And there's some good over-the-counter things you can do for this. First of all, get a good lubricant. And you can talk to your pelvic physical therapist, you can talk to OBGYN, we can guide you. There are a ton of them out on the market. My biggest recommendation when it comes to lubes, lubrication, sorry, it's not about the bells and the whistles. We don't need smells, we don't need flavors, and we want it to be as simple as possible, because a lot of these lubricants can have a lot of additives that can, and maybe alcohol bases that can actually be really aggravating. So really talking about the ones, kind of targeting to the ones that work best, but obviously this is going to be a decision between you and your partner, which ones do you like best. Something else you can do that's really simple over the counter are vaginal moisturizers. There are also a ton of these. And this is actually, I tell my ladies, I'm like, so you're going to moisturize your face and then you're going to do your vaginal moisturizer. So it's actually a maintenance. And this is something you're going to do 2 to 3 times a week. Like I said, there are tons of them on the market. So vaginal lubrication is for when there's active foreplay. And then vaginal moisturizer is just to help maintain the integrity of the tissue and help it not to dry out.
Yeah, so I talk to a lot of my patients, especially postmenopausal or kind of that semi-postmenopausal that we get with some of the hormone replacement related to breast cancer, is coconut oil or anything like that. If those tissues are dry, think of like when you've got kind of like that sunburned dry feeling. You don't want anything rubbing against it, so we want to moisturize and help with that. So that's where those moisturizers come into play. My favorite one to recommend to kind of the general public, not specific to the individual case, is coconut oil.
Yeah, a lot of people like those natural oils, coconut oil. Obviously, it's cheap, it's easy to come by.
Yeah.
So
very, 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 very few people have any negative reaction to it. So it's a general safe one, but if you have any questions, please talk to pelvic floor specialist, OBGYN.
Whoever you can talk to. You know, a lot of people don't want to talk about sex, but if you can find someone and talk to us.
There's a few of us in Chattanooga. So that's kind of pain with like dryness or with those tight musculatures. So if they're getting pain kind of when they're living their day-to-day life, sitting in that chair getting chemo, or and you know in the car ride over to whatever treatment they're going to, just to their daughter's house,
right?
Anything like that.
Yeah, something like that. I would think more along the nerve route, maybe a pudendal nerve or a sciatic nerve. And so we can do testing if we think that, obviously if you're a breast cancer or cancer patient, we're always worried about something being impinged, so we may want to get some imaging for that. Most certainly work with your oncologist and make sure they don't think it's anything in that area. But if we rule out anything terrible, hopefully it's just more of those very tight muscles. So again, we can do certain exams in the office, see if we need to get imaging, and if we think it's more of that tight musculature, we can get you over to a physical therapist. It may not have to be a pelvic physical therapist. Maybe you're a regular physical therapist, and they can run you through some exercises, stretches to help out with those tight muscles.
Yeah, because a lot of the, you know, when someone comes to me with, you know, sciatica or the pudendal nerve, which goes to the pelvic floor, I'm not working on it inside.
Right.
It's coming from the spine, right, and the muscles through the glute. And so a traditional physical therapist can also help with a lot of that nerve type pain. So you don't have to go see a pelvic floor therapist.
Right.
You can go see traditional PT to help with the spine and all of that, which is fantastic.
Yeah.
Because there's a lot more of those now.
Absolutely.
Okay, so if someone comes to you and goes, oh my goodness, since, you know, I had all my treatments, every time I sneeze, laugh, cough, I'm wetting myself.
Yep. Incontinence. So that is a multi-billion-dollar industry just to get pads and diapers. So this is a real problem. That is why it's a multi-billion-dollar industry. And women do not want to talk about it. They're embarrassed. So there are basically two types of incontinence. What she's talking about, the stress incontinence, that's cough, sneeze, laugh, anything that increases that pelvic, the pressure in your pelvis. The other one is urge incontinence, and I don't know how, you know, for people who are my age, I'm sure you remember the gotta go right now, that commercial. They did a great job.
I know that one.
They did a great job with that one. So that is when you feel like you need to pee, you cannot hold it. Like traditionally, that's called the key lock syndrome, where you're at the door, you're unlocking the door, but you cannot hold it, you pee on yourself. So that's called urge incontinence. So urge incontinence is usually fixed by medication. We can also do bladder diaries. We can do fluid restriction. We'll look at your caffeine. There are all kinds of food and things that can, all kinds of things that we can do to help with overactive bladder. That's what that's called. Stress incontinence. There are actually a lot of good things you're coming up with for stress incontinence. We used to always say overactive bladder is medical treatment, stress is surgical. It's not like that anymore. Stress, they're doing Botox now. They have like a nerve stimulation they can do on your ankle. They have all kinds of things they can do for stress incontinence. So we usually break it down into either overactive or stress, and then help you figure out something along that way. And the first thing that I'm going to do when you come into a general OBGYN's office is make sure it's not a urinary tract infection.
Yes.
Right? Easy smeezy.
Please.
I know. Easy smeezy. Let's take care of that.
A full assessment, not just a, oh yeah, that's probably what it is.
Right. So, anyway, so yeah, the easy thing is rule out infection, and then we can talk about the different types of incontinence and what we can do for each one. Something else just along those lines is something called painful bladder syndrome. So that would be like if you have pelvic pain, it doesn't go away with just urination. But a lot of it can get confused with everything. Unfortunately, you think you have pain in your uterus, you think you have your ovarian cyst. It's just an inflamed, painful bladder, and a lot of times it will become more painful, like when you urinate. But anyway, we have lots of tips and tricks we can help with painful bladder syndrome. Lots of foods that cause triggers, so we can go through your diet. So basically, the bladder has lots of things we can do.
And one thing to mention, especially, you know, post-cancer treatment or even during, she did mention fluid restriction. Please don't just completely restrict your fluid restrictions.
Yeah,
don't just go there right away. That can be one of the things with guided help.
Yes. Yeah, don't put all that fluids.
I know some people will grab onto that one, so I want to clarify. Yeah. But yeah, so a lot of this is easily helped with a team, okay? So you got your cancer team, right? Your oncologist, your surgeon, your radiologist, whoever it may be, bring in your OBGYN, because this is your whole body, right? Your hormones are being affected by this surgery, by these treatments. Your OBGYN is a huge resource for that, okay? Pelvic floor PT can help with a lot of the muscular side of things, and we work really closely together to help understand that. And things you may not even realize, some antihistamine medications, right, can affect the pelvic floor. Stuff you may not quite realize and that you can actually get help with, okay? talk to these wonderful doctors.
Right. And make sure you know that you're not alone. There are millions of other people going through this with you, and there are tons of us who want to help you out. So just keep that in mind.
So if you have any questions, please email me, reach out to me. I can try and get you in touch with Dr. Yergo, something specific for her, but we don't want to overwhelm her. But I can definitely help field a lot of the questions if you guys have any. Do you have anything else you'd like to add?
No, I don't think so. Thank you so much.
Thank you so much.